So after a concussion, there's a reduction in blood flow to your brain. And in animal studies, they've shown it as much as 50%. Human studies are a little bit mixed, and sometimes the blood flow goes up and sometimes it goes down, and it's all over the place. So really what you have is a dysfunction in blood flow regulatory mechanisms to your brain. And there's four main reasons why this could be. It could be changes in even breathing rates or the partial pressures of CO2 within your blood. It could be due to changes in blood pressure in your body systemically. It could be due to changes in your heart rate variability and your sympathetic and parasympathetic nervous systems. Who cares why it is, okay? The fact is that when you have these blood flow impairments, when you change what you're doing, so you might feel okay at rest, but when you go out and do something like increase your cognitive load or increase your physical load, you go out and do exercise, you haven't done it in a while, all of a sudden you start to feel symptomatic. And you think immediately, oh my God, I did too much. But the reality of the situation is it just shows that there's some sort of issue going on with blood flow maybe, or like your autonomic nervous system. The treatment for that is exercise. But again, we've all been led to believe that exercise is bad for concussion, and what you really need to do is rest. But rest by itself, if you were to do nothing but rest, even without a concussion, if you were to get put on bed rest alone in as little as 12 to 24 hours starts to impair the same blood flow mechanisms that concussion does. So concussion by itself can impair blood flow mechanisms. Rest by itself can impair blood flow mechanisms. Now you take a concussion and tell them to rest, and now you're screwed. So now you feel comfortable when you're resting, but as soon as you do anything, even go up a flight of steps, you feel lightheaded. You get a headache. Even when you go, out and about, or you try reading a book, you get symptomatic. Right? You increase your cognitive load even marginally, and the symptoms come on. So what do? You react by avoiding that. The reality is you need to push into that. You need to do a little bit more. Okay, the treatment is exercise. And usually the way that this is done is you have to go and do specific treadmill testing to try and find out what your physical capacity is. And once we find out what your physical capacity is and what you're able to do, we progressively push you into an exercise program. But we don't want you exercising up here where your symptoms are. We want to pull down just a little bit so that you can exercise safely, and then we can bump you up afterwards. So what can you do at home right now is you can start light to moderate exercise every single day, 20 to 30 minutes. Before you're getting into the treadmill test, if you don't have anybody that can test you on it, but you want to start somewhere, go for a walk every single day, 20 to 30 minutes. Then increase your pace. Start challenging yourself a little bit. Are some of you going to feel really uncomfortable and kind of crappy after your first walk? Yep. But the next time you do it, you won't. Or you won't as bad. And the next time you do it, it'll be less. And the next time you do it, it'll be less. And the next time you do it, it'll be less. The example I always use for this is being just out of shape. Just imagine the fact that you haven't done anything for so long is the fact that you're out of shape. So if I haven't been to the gym in a while and I decide I'm going to go back, I'm dying. Right? I can't lift the weights I used to lift. My cardio's crap. And then I come home and I'm like, oh my God, like I'm just destroyed. And then I'm sore for a few days after that because I'm not in shape. But as I get back into shape, I don't get crushed as much during my workout. I don't get crushed as much after my workout. And my muscles aren't as sore for as long after my workout. Right? I'm not saying that, if you used to be a runner, don't go back and just start running right away. You have to build up to that because you're out of shape. If I was to try and run a marathon tomorrow, I would die. But if I made my plan to run a marathon in 8 months, I could train appropriately and build up by starting with running 2K tomorrow, right? Then 2K the next day, then 2K the next day. Am I going to be sore after 2K? Yep. But after I do that for 2 weeks, 2K will be easy. And then I bump myself up to 3K, 4K, 5K, all the way up till eventually I'm now in my marathon training mode. And I will eventually be able to run that. Everything is, your body will adapt to the stresses you put on it. If you react by pulling back and not stressing your body in any way, your body gets worse, right? Am I going to get in better shape by not exercising? No, like it doesn't make any sense, right? Okay, so what can you do for yourself? You want to start light to moderate cardiovascular based exercise, steady state. Lifting weights sometimes is challenging. If you get into weights, because what happens is your heart rate spikes and then it drops, and then it spikes and then it drops, and then it spikes and then it drops. And those fluctuations are often more difficult for your brain vasculature to respond to. So what you want to do when starting out is just steady state and monitor your heart rate. Your heart rate will be the key. If your heart rate is at a certain level and you feel okay with that level, next day, try to bump it up slightly so that your main heart rate is slightly higher, and see how you feel after that. And then the next day, see how you feel after bumping it up even more. Once you find an area where you're like, okay, well, that one kind of made me feel symptomatic, drop it back slightly and do that for a week, and then try to bump it again and keep doing this. Like I said, you likely will need a treadmill test at some point, but this is something you can do right now to start making yourself feel better. Exercise improves blood flow, mood, you get endorphin release, you sleep better. It's everything. Okay, exercise is medicine, and it's been shown for a number of different conditions, and concussion is one of those conditions. And this has been proven. This is not just like, fringe science. This has been proven.